So the purpose of our research was primarily to ensure that patients in our institution in Bristol were receiving a quality service when they undergo CT colonography for the investigation of colorectal cancer. And there was a secondary purpose that we wanted our data to add to the existing body of evidence that supports the use of CT colonography in the investigation of colorectal cancer. So the way we carried out our study is we collected information on all the patients that underwent CT colonography between January 2010 and January 2015. We also collected information on patients that were diagnosed with colorectal cancer during that period from the UK Cancer Registry, which is the gold standard data for cancer monitoring in the UK. And we compared the two to identify any patients that were diagnosed a significant period of time after their CT colonography investigation. So the results of our study show that we performed 5,058 CT colonography examinations in 4,921 patients. That was a mix of symptomatic and screening patients. The majority of those were performed for the primary diagnosis of colorectal cancer. Some of them were performed after patients had been diagnosed, either as follow-up or because optical colonoscopy had failed when looking for a synchronous primary. So those patients were excluded from the study. Of those 5,058, 198 patients were diagnosed with colorectal cancer. That's 3.9% of our study population. We looked in detail at those patients to identify any that had a long delay between CT colonoscopy and diagnosis. And there were 5 patients that did have a significant delay, and that was our group of potential missed cancers. We looked in great detail at those patients to identify whether or not these were true misses. 3 of those patients were diagnosed over 2 years after their CT colonography investigation, and on retrospective review of the imaging, those tumours weren't visible. There were 2 patients that when we went back to look at the imaging, the tumours were visible in retrospect. So that's 2 out of 198, which gives us a sensitivity of 99%, which compares favourably with a systematic review that was published in 2011, which gave a sensitivity of 96.1%. So we hope our study will improve outcomes for colorectal patients in a couple of ways. Firstly, it shows that the service that we offer in Bristol in our institution is high quality. We're not missing too many cancers. Our sensitivity is similar to the published evidence. So that's reassuring from a local point of view. But we also hope that our data will add to the existing body of evidence to give further support for the use of CT colonography in the investigation of colorectal cancer.